Hello, my friends. I'm Dr. Linda Parker, urologist and senior health specialist. And today we're going to talk about something that very few people over 60 have actually heard explained in simple terms. How a single, healthy vegetable can quietly thicken your blood overnight if you're not careful. And what you can do to protect your heart, your brain, and your circulation without giving up the foods you love. For decades, we've been told that if a food is natural, green, and packed with vitamins, it must be safe for everyone in any quantity. But when we reach our 60s, 70s, or 80s, the body plays by slightly different rules. Many of you are taking medications to protect your heart, prevent strokes, or avoid clots in your legs. And in that context, one innocent-looking vegetable can suddenly become a problem, not because it is bad, but because it changes how your blood behaves. So in this conversation, I want to give you clarity, not fear. You're going to understand what people really mean when they talk about thick or thin blood, why this matters so much after 60, which single vegetable can tilt the balance almost overnight if you're on certain medications, and most importantly, how to keep enjoying your meals while keeping your circulation safe. By the end, you'll know exactly what questions to ask your doctor and what simple habits can keep your blood flowing smoothly. Let's start by clearing up a common confusion. When you hear someone say, "My blood is thick," they're usually talking about one of two things. The first is viscosity, how easily blood flows through the vessels, like the difference between water and honey. The second is clotting tendency, how quickly the blood forms clots. Both of these are important because blood that is too thick or too eager to clot makes it harder for oxygen to reach your brain, your heart, and your legs. That's when problems appear. Strokes, heart attacks, clots in the legs that can travel to the lungs, or sudden worsening of circulation in the feet. This is why so many people over 60 are prescribed blood thinners or anticoagulants. These medications are meant to keep your blood flowing freely enough that it doesn't block the arteries or veins at the wrong time. But here's the catch. Your blood is not only influenced by pills, it is also influenced by what is on your plate. And this brings us to the vegetable in today's title, the one vegetable that can thicken your blood overnight, especially if you are taking certain anticoagulant medications, is kale. Yes, the same kale that shows up in smoothies, salads, and superfood juices. Kale is not a villain. In fact, for many people, it is incredibly healthy. But it is also one of the richest natural sources of vitamin K. And that's where things become complicated for seniors on blood thinners. To understand why kale deserves special attention, we have to talk briefly about vitamin K. Vitamin K is essential for your body to form clots and stop bleeding when you get a cut. Without it, even a small injury could cause dangerous bleeding. Your liver uses vitamin K to produce clotting factors, small proteins that help your blood to solidify when necessary. So vitamin K itself is not a problem. The trouble arises when we combine very high vitamin K intake with certain medications designed to thin the blood. One of the most common anticoagulant medications in seniors is warfarin, also known by brand names you might recognize. Warfarin works by interfering with the way your body uses vitamin K. In simple terms, it nudges your body to clot more slowly, so your risk of stroke or clot formation goes down. Doctors carefully adjust your dose based on a blood test called the INR, which tells us how quickly your blood clots. Here's the key. If you suddenly eat a lot of vitamin K, your body can bypass some of warfarin's effect. That makes your blood more likely to clot again. Now imagine this scenario. You've been taking warfarin at a stable dose for months. Your INR is in the safe range. Then a friend tells you, "You have to try this green smoothie. It's amazing for energy and detox, and it's packed with kale." You drink a large glass that evening and repeat it the next morning, feeling proud of yourself for choosing something healthy. Inside your body, that sudden surge of vitamin K from the kale pushes your clotting system in the opposite direction of your medication. Within about a day, your blood may start clotting a bit faster than your doctor intended. This is what people mean when they say kale can thicken your blood overnight. The vegetable itself is not toxic. The problem is the combination of kale's vitamin K content with a medication designed to keep your blood from clotting too quickly. For someone on warfarin, that sudden change can shift the INR out of the safe zone. Your risk of stroke, heart attack, or blood clots in the legs can increase, even though you believe you are doing something healthy. Now I want to pause and say something very clearly. If you are not on warfarin or another vitamin K-sensitive anticoagulant, kale is generally a wonderful food. It supports heart health, provides antioxidants, helps digestion, and can be part of a very balanced diet. The goal here is not to demonize kale or any other leafy green. The goal is to help you understand that, in the context of certain medications, suddenly adding or removing large amounts of kale can be risky. So who should be especially careful with kale and other very vitamin K-rich vegetables? The first group is seniors taking warfarin after a stroke, a blood clot in the leg, or a clot in the lungs. The second group is those with mechanical heart valves or atrial fibrillation, where blood thinners are used to prevent clots from forming in the heart. The third group includes people who have had recurrent clots and are on long-term anticoagulation. If you are in any of these categories, your doctor is relying on a stable relationship between your medication dose and your diet. Your liver cannot read labels or watch health videos. It simply responds to what you give it. When you suddenly flood your body with vitamin K from kale, spinach, collard greens, or similar vegetables, your liver quietly shifts gears and starts producing more clotting factors. If your warfarin dose was set based on a lower vitamin K intake, that dose may temporarily be too weak. It is as if someone turned down the volume of your blood thinner without your knowledge. The phrase overnight here is not magic. It reflects how quickly our chemistry adjusts. For many people, a dramatic change in vitamin K intake can begin to influence clotting within 24 to 48 hours. That's why we worry when someone on warfarin says, "I decided to go on a green juice cleanse," or "I read that kale salads are the secret to longevity, so I started eating them twice a day," without talking to their doctor or anticoagulation clinic. Let me give you a very real example, similar to cases I've seen in practice. A 72-year-old man with a history of atrial fibrillation had been on a stable dose of warfarin for years. His INR was always in the safe range. He rarely ate leafy greens. One winter, he joined a wellness challenge at his gym. The goal was to drink a large kale-based smoothie every evening and every morning for 30 days. No one mentioned warfarin. After a week, he felt a little more energetic, but then he developed pain and swelling in his left calf. He thought it was from exercise. 2 days later, his leg was red, hot, and very swollen. At the hospital, tests confirmed a deep vein clot, and his INR was below the therapeutic range. His medication had not changed. His diet had. This does not mean kale caused the clot all by itself. Clotting is always the product of multiple factors: age, genetics, hydration, movement, hormone levels, and more. But that sudden flood of vitamin K from kale shakes counteracted his medication just enough to tip the balance. That's how a so-called superfood can become a hidden risk, especially overnight when changes are sharp instead of gradual. At this point, you might be thinking, so should I never eat kale again if I'm on blood thinners? The answer is more nuanced and more hopeful than a simple yes or no. In most cases, doctors do not ask you to avoid vitamin K-rich vegetables forever. What they want is consistency. If you usually eat a small portion of greens every day, they can adjust your warfarin dose around that habit. The danger comes from sudden swings. No greens at all for months, then large bowls of kale salad for a week, and then back to none. Consistency is your best ally. If you love kale and your doctor knows you eat it regularly, your dose can be calibrated so that both the vegetable and the medicine work together safely. If you do not normally eat greens and want to start, it is absolutely possible. It just needs to be done gradually and with supervision, so your INR can be monitored and your dose adjusted if needed. This is how we turn a potential risk into a controlled, safe habit. There is another trap that catches many seniors: concentrated powders and supplements. A spoonful of green powder that you mix into water or juice can contain the vitamin K equivalent of several cups of kale or other greens. Because it looks small, people assume it is gentle. But for someone on warfarin, that small scoop can behave like a megadose of vitamin K. You might not even realize it, because the product is marketed as natural, detoxifying, or immune-boosting, rather than as a vitamin K supplement. So I encourage you to read labels carefully. Look for ingredients like kale, spinach, collard greens, broccoli, and green blends. If you see them listed and you are on warfarin, do not start that product without telling your doctor or your anticoagulation clinic. Bring the bottle or a photo of the label to your next appointment. A 5-minute conversation can prevent weeks of unstable clotting and potential complications. We also need to talk about symptoms. Unfortunately, you cannot feel your INR. You cannot feel your blood getting thicker or thinner just by paying attention. However, you can learn to recognize warning signs that demand immediate medical attention. Sudden swelling, redness, and pain in one leg can signal a deep vein clot. Sudden shortness of breath, chest pain, or coughing up blood can indicate a clot that has traveled to the lungs. Sudden weakness on one side of the body, difficulty speaking, facial drooping, or vision changes can be signs of a stroke. If any of these symptoms appear, do not stay at home wondering whether it is from your kale smoothie or your medication. Go to the emergency room or call your local emergency number right away. Time is critical. Doctors can sort out the cause later. Your job in that moment is to act quickly. Now, I also want to prevent the opposite problem because fear can push people into extremes. Some seniors, after hearing that kale and vitamin K influence clotting, decide to avoid all green vegetables forever. They live on bread, pasta, and processed foods to stay safe. This strategy backfires. Your blood vessels, your heart, your brain, and your kidneys all benefit from the vitamins, minerals, fiber, and antioxidants in vegetables. Avoiding them entirely can worsen blood pressure, cholesterol, weight, and blood sugar control, all of which increase your risk of the very strokes and heart attacks you are trying to prevent. The healthiest path is balance with knowledge. Kale is not the enemy. Ignorance is. When you understand how it interacts with your medication, you can make informed choices instead of living in fear. You can enjoy a colorful plate, support your overall health, and still keep your blood in the safe zone for clotting. So let's translate all of this into clear action steps you can use starting today. Step 1. If you are on any blood thinner, especially warfarin, make a list of all the vegetables and supplements you consume regularly. Include kale, spinach, collard greens, broccoli, green powders, and multivitamins. Bring this list to your next appointment and ask your doctor, is this pattern stable and safe for my medication, or do we need to adjust something? Step 2. Avoid big surprises. Do not suddenly decide to double or triple your intake of kale from one day to the next. If you want to eat more of it for the long term, increase slowly and let your doctor know. They may order an extra Indian rupee check during the transition and adjust your dose. Step 3. Be skeptical of wellness challenges and detox programs that promote large amounts of a single green ingredient, especially if you are on anticoagulants. What is safe for a 25-year-old with no medical conditions may not be safe for a 72-year-old with a history of clots. Step 4. Stay well hydrated and keep moving. Thick, sluggish blood is not only about vitamin K and kale. Dehydration, long periods of sitting, and lack of movement can also increase your risk of clots. Simple things like drinking enough water, flexing your ankles when sitting, standing up regularly on long trips, and walking daily can help your circulation tremendously. Your blood loves gentle, regular motion. Step 5. Never adjust your warfarin dose on your own because you changed your diet. If you ate more kale than usual one week, do not skip doses or double doses to compensate. That kind of self-adjustment can be far more dangerous than the kale itself. Let your medical team guide the changes based on real blood tests, not guesswork. I want to leave you with an encouraging story. An 80-year-old woman came to my clinic convinced she had to give up every green vegetable because of her blood thinner. She loved kale soup, spinach with garlic, and mixed salads, but had stopped all of them after a frightening episode of low INR. She felt tired, constipated, and frustrated. Together with the anticoagulation clinic, we created a plan. She would eat a small, consistent portion of greens every single day, not large bowls once in a while. Her warfarin dose was adjusted carefully. Within weeks, her energy improved, her digestion normalized, and her INR remained stable. She did not have to choose between her medication and her vegetables. She only had to choose consistency and communication. That is the heart of today's message. The one vegetable that can thicken your blood overnight is kale, not because it is poisonous, but because its powerful vitamin K content can silently counteract your blood thinner if you suddenly flood your system with it. After 60, nothing in your health happens in isolation. Your food, your medications, your circulation, and your daily habits are all connected. Before you leave, take a moment to look at your own routine with fresh eyes. Is there a healthy habit you started without telling your doctor? Write it down. A short, honest conversation about that smoothie, that supplement, or that new vegetable soup might be one of the simplest ways to prevent complications and protect your long-term independence. Thank you for spending this time with me today. I'm Dr. Linda Parker, and I hope this conversation has given you practical tools to keep your blood flowing safely while still nourishing your body well. Take good care of yourself, stay curious about what you put on your plate, and I'll see you in the next video.